Hi, I'm Vivek Reddy from Mount Sinai Hospital in New York, and I'm the director of the electrophysiology section. So, one of the big advances that's occurred in our field on the pacing side is the recognition and the importance of conduction system pacing. About, in the beginning, 10, 15 years ago, people were playing with trying to pace directly the His bundle. Now we're increasingly putting a conventional lead, burrowing it through the interventricular septum to pace the left Purkinje system, which is a much more stable way of pacing the conduction system. And what we've learned is that, particularly in heart failure patients, conduction system pacing seems to be very, very important for the best long-term outcomes in terms of reduction of heart failure hospitalization, even mortality. And there's increasing data that even in patients who don't have heart failure, conduction system pacing may be better in terms of the prevention or the inception of new heart failure. Now, coincident with the advances in our knowledge of conduction system pacing, about 12, 13 years ago, we saw the advent of leadless pacemakers. So pacemakers, instead of putting the device here, obviously are very small. We could put them directly in the heart. And these devices work very well. But one important limitation of leadless pacing has been the current inability to perform conduction system pacing with these devices. So an important question is, can leadless pacers perform conduction system pacing? And that's where this study comes to the fore. This study was a first-in-human feasibility study where we were trying to assess whether we could take a leadless pacemaker that's been modified to have a longer nose to it, whether or not we could, similar to conventional conduction system pacing, could we burrow it through the interventricular septum and pace the left bundle system? And so that was the goal. It was a single center feasibility study, and it was also so-called pass-pull study. So these are patients who were indicated for pacing. We tried to put the device in, we got our measurements, and then once we had all the measurements, we took the device out and put in a conventional leadless pacemaker in these patients. So we performed the procedure. There were a total of 14 patients that were enrolled into the study. Two patients we aborted because the pre-procedure echo and CT imaging as indicated this is a very small atrium, and we thought it'd be difficult to position the device. Two other patients, we tried to position, we never could get a good position, and so we got no measurements. So we're able to get measurements in 10 of the 14 patients. And what we saw was that we performed left bundle area pacing in about half those, in 5 of those 10 patients. And the remaining patients we performed or we achieved either sort of deep septal pacing or LV septal pacing. So I think that overall we were pretty, um, let's say, we were happy that it's possible to perform conduction system pacing. But we also learned a number of things. And one of the important things that we learned is that the device will likely need to be modified somewhat so that we can more reproducibly position it where we want to position it. So the next steps for this leadless conduction system pacing device is that there are modifications being performed, and once those are done, then we need to assess again whether or not we can put the device in safely and achieve good conduction system pacing. Um, and then after that, the anticipation is that there'll be a large multi-center pivotal trial so that we can assess this in the hands of many operators and hopefully gain regulatory approval if this works.